Okay, good evening, everyone, and welcome to our webinar, which will be today on the subject of the importance of the communication between clinician and the clinical laboratory as the key for proper medical care. The talk will be, of course, with the examples and the relevant data from corona monitoring in Israel. The speaker today, I would like to thank Dr. Avi Peretz from Israel, which is the president of the Israeli Society of Clinical Laboratory Sciences. Dr. Peretz is directing a clinical microbiology lab in a hospital in the north of Israel. He is the head of a research laboratory. He is teaching in a couple of academic institutes. And I would like to thank him on behalf of my colleagues from the EFLM group for accepting our invitation and giving us this talk today. During the talk, we would like to be interactive, so you, the audience, will be asked to share information with us concerning comparing different processes and methods from different countries. So we make the discussion more interesting. So please, whoever would like to speak, you can use the raise hand function or write in chat. The questions will be at the end of the talk. Again, whoever wants to just write a question, I will read it, or if you would like to speak, you will unmute your microphone and the video, you can start the video and speak. I think we can begin. So now, before we begin, I will ask everyone to please mute the microphone and stop your video. And Dr. Peretz, the stage is yours.
Thank you, Dganit. Let's start. I close the video so it'll be more easy for me to talk. Let's start. Hello, everyone. Good afternoon or good evening. My name is Dr. Avi Peretz, and I really appreciate your joining this seminar and finding the time waiting this crazy coronavirus time. First of all, I wish to introduce myself. I'm the manager of the clinical microbiology and the Research Institute of Korea Medical Center. Like Denise said, this is the General Medical Center located in northern Israel. The hospital has 400 beds. And this is a picture of the hospital, one of the most beautiful area in Israel. This is the Sea of Galilee, and as you can see, everything is green during this time. In addition, for the last 2 years, I'm serving as the president of the Israel Society for Clinical Laboratory Sciences. And I have chosen to dedicate this seminar not a specific topic or a particular test or a new instrument or technology, but to a more general topic that I think is one of the most important things that each of us need to address in the institution where we work. The presentation deals with the importance of a relationship between the physician and a medical laboratory. I will do my best to provide examples and some information to demonstrate how we handle this issue in the hospital where I work. I apologize in advance for the fact that the examples I give are from the field of microbiology, but I'm convinced that there are also many examples related to other laboratories. So before we start discussing this specific topic, I would like to take a few moments to tell about the current state of medical laboratories in Israel. In total, there are 409 laboratories in Israel which are licensed by the Ministry of Health. A small portion of them are private, and other belong to hospital and health fund, the HMO organization. Over the years, laboratories of HMO in Israel have been merged into giant laboratories, also known as a mega labs. At the same time, each hospital in Israel has its one laboratories division of variable size. Unlike other countries, Israel does not have laboratories that serve several hospitals. Of course, that there are tests that are transferred between the hospital and the laboratories that specialize in a specific field. Almost all laboratory workers and laboratory managers in Israel come from the field of life sciences, medical science, biotechnology, and they are not physicians. There are very few physicians in Israel who are also expert in medical laboratory field, such as microbiology and biochemistry. And this is a very important topic, since the authority of the physician different from the authority of the laboratory worker or a laboratory manager. And this can affect the working relationship. I'm sorry to say, but a physician are often perceived as the source of knowledge and decision maker, and not the lab worker or lab manager. The training process of a medical laboratory worker in Israel is long. In fact, in order to work in a medical laboratory, you need to obtain a license from the Ministry of Health. The process of laboratory worker training includes internship, basic preliminary examination in one of the laboratory specialties, and later on, in order to become a senior laboratory worker, you must pass an oral exam with a committee of experts. Only after passing the entire track and after years of experience gaining, you can become a manager in a medical laboratory. In Israel, has three academic institutions that offer a B-Science degree, a specific degree in medical laboratory science. And each year, about 150 students graduate in this program. I'm very proud to say that the medical laboratories in Israel are at the forefront utilization of advanced and state-of-the-art technologies. The following slide is very relevant for this period, and it demonstrates the mobilization of medical laboratories in Israel to carry out coronavirus tests. As you can see, this is Israel. As you can see, there is a steep increase in the number of tests per day. And recently, Israel was highly ranked compared to other countries in the context of conducting a coronavirus test per capita. I must say that the mobilization of medical laboratories in Israel was amazing. Okay, so now let's discuss our main topic for today. As we all know, in recent years, the field of medical laboratories is undergoing significant changes resulting from the introduction of new technologies as well as economic constraints. We see more automated devices. The accuracy of the device is higher. There is a strong emphasis on preventative medicine that increase the number of the tests, and therefore the medical laboratory should provide knowledge and not just information or data. There is an increasing use of point of care testing, and regarding this, in Israel, all the point of care field is managed by the laboratory workers, and as an association, we strongly oppose to the option of laboratory tests being performed by other professionals. And just recently, we had a struggle with the proposition allowing HbA1c testing by a pharmacist. In any case, all the points mentioned above are alienating and disconnecting the laboratory from the clinical context and create a feeling that laboratory testing is no more than a commodity to be supplied. Again, maybe it's my feeling, but medical laboratory workers have become transparent. This is a slide I really like and discusses it whenever I can. It demonstrates the importance of laboratory tests. The test does not only help determine the diagnosis, as many people think. It also assists in determining the optimal treatment, adjusting treatment to a specific patient, and of course, determining the prognosis. It should be emphasized that the expenditure on laboratory tests compared to other area of medical is relatively low, but is a huge impact. As mentioned here, lab tests influence about 17% of the medical decisions. On the personal level, I'm always working on positioning the lab as a department that must be involved in every discussion and every institutional decision made. It's important for me to always emphasize the importance of relationship between the laboratory and the medical staff, since it has a critical impact on the quality and the safety of the patient care. Laboratory workers have a knowledge that should be used. This is a very important message for all lab workers. We have to increase the exchange of information between the physician and the laboratory workers and vice versa. So the result of the test will be more significant. We have to sit together, physician and laboratory worker, to build protocols which will help us to make a uniform decision. In the context of lab staff knowledge, I choose to put this beautiful picture that I think sums up the importance of the medical lab work. This is a slide that I assume you all have previously seen. It describes the life cycle of the test. It's important to show this slide to any medical staff member. Why? There is a tendency to treat every laboratory error very seriously. And right so, since it can have a critical impact on the patient. But it must be noted that the most errors do not happen in the lab. The high percentage of error is observed in the pre-analytical stages. These are stages when the test is ordered, collected, and transported to a laboratory. These slides show example of common error depending on different stages of the test. And here is a great example of two studies that collected data about the type of error associated with laboratory testing. And here you can see what I mentioned before. A very high percentage of error occur before the test arrives to the laboratory. A very important issue, information flow to the lab. What information should be flowed to the lab and why? It's very important to insist for every test form to specify information that can help the laboratory to make effective decision. Not everything is automatic in the lab. The information should be demographic, epidemiologic, and clinical. It should specify the patient current medications, is a concomitant disease, as well as suspected conditions. Unfortunately, this information is not supplied at all, or supplied only partially. And here is an image of a form. Unfortunately, I do not have examples in English. Therefore, I use this ones in Hebrew, and I try to explain. These are tests ordered completely by hand. The referring clinician did not bother to provide relevant information or even clearly indicate which test he required. You can see here, it's a blood culture order, and you can see that the physician put X and V about in two kind of culture. Here, the physician needs to tell us what is the diagnosis and if the patient get any antibiotics. He don't write nothing. And also here you can see the physician write in Hebrew, zinat, this is the name of the antibiotic. But this is not correct, and not anyone understands this if the doctor not use the true name, it's cefuroxime. So what can we do? I suggest switching to a computerized test order form, even in a small hospital. Not only this, but the test order will contain mandatory field that must be completed. As you can see here, this is a urine culture order, and you can see here, this is not clearly, but the doctor don't tell us how the urine collect. And this is a computerized order, and we have here all the information that the lab needs to get to do the best things. Another example, this is an example of, again, of a computerized test order. And as you can see, the doctor provides information about the patient. You can see here, the physician tells us that the patient has the CLL. And it is very important to know about this problem, because maybe the patient is an immunocompromised patient, and we must know this in the lab. So which clinical and the epidemiological information should be noted? Chronic disease and clinical condition, mainly those associated with immunosuppression. In the field of microbiology, for example, any information about visit in other countries, and even about occupation. Anyone who specializes in clinical microbiology know that are infection disease that are common, for example, in fishermen, farmers, etc. And I will provide a very relevant example. The staff in the Israeli microbiology labs knows that before the Jewish New Year and the Passover, there are usually many cases of infection that develop due to fish fin injuries. This is because our mother make Jewish food, gefilte fish. When the doctor who drains the pus and send it to the lab, describe the case on the form, the laboratory can direct the work process and look for a specific pathogen called the Vibrio vulnificus found on the fish fin. So I will stress this again. Clinical and epidemiological information helps to direct the laboratory and enable to adjust a work process. Again, this is very important for the microbiology lab, since this information allows to choose the grow media, adjust a time, and decide on the incubation condition according to the pathogen we are looking for. Another important issue, proper collection of sample. This is a very problematic issue that requires constant re-education. The medical teams should always be reminded that improper collection may cause a false positive or a false negative result. This image illustrates a very fascinating issue of the microbiology lab work. Collection of wound and pus cultures. There is a common misconception that proper collection is done using the swab that we see here in the picture. However, sometimes the pathogen is an anaerobic bacterium which died open exposure to air. So therefore, whenever possible, a sample should be taken by aspiration and remove air bubbles from the syringe like you see here. Here is another important example, urine cultures. Since urine cultures is quantitative and the result includes a report of the number of developed colonies, it's important to transfer the sample to the lab as quickly as possible. It can contain also external contaminant, which may be overgrow and cause a false positive result in a patient who does not actually have a urinary tract infection. So try to think of the amount of retesting required in these cases. Think of the amount of unnecessary antibiotic use. Here is an example of solution. Point of care urine cultures kits allow applying the sample directly on the grow media by the nurse. This way the growth will only include the pathogens found in the urine itself, the correct number. Here is an example of what we use in the hospital. This kit is very convenient. The main problem is that in the case of shock during transplantation, the sample, the grow media may be break. And here you can see how the use of this technique has affect the situation in our hospital from 2017, when urine culture were transported as usual in a sterile test tube and seated in the laboratory, to 2010 when we started using this kit. There are less mixed culture and also less positive culture. And again, a lot of money and antibiotic were spared. This slide demonstrates another critical example, blood cultures. It is known that injection of a small amount of blood into a bottle in a way that does not comply with the manufacturer instruction lower the sensitivity of the test or leads to delay for the result. In addition, there is a guideline specifying which bottle should be injection first, aerobic before anaerobic. It allows to the air therefore in the syringe and nozzle to be injected into the aerobic bottle rather than anaerobic bottle. In addition, the pediatric bottle is effective for grow facultative aerobic bacteria, while for the obligate anaerobic bacteria, its sensitivity varies. Unfortunately, many pediatricians don't know this information. And still, many of the bottles we receive do not contain a sufficient amount of blood, and the collection order is incorrect. It is very important to show this slide to a physician in order to emphasize the volume of blood that should be injected into the bottle. In the context of blood culture, I will tell you a story to demonstrate how important factors are sometimes overlooked. One bright morning in my hospital, of course, after coordinating with the infection disease unit, we replaced the anaerobic blood culture bottle that we used for many years with an orange cap, this bottle, with a new bottle that has a purple cap, this bottle. This is a lytic bottle which contains a substance that causes lysis of white blood cells and red blood cells, therefore releasing observed bacteria to increase the culture sensitivity. With the exception of a small number of nurses, no one asked what the bottle change means and whether it's just a color changer or is there another significant change. And I have a feeling that no surgeon, for example, will the quality ignore a change in the equipment used in the operating room. He will immediately start to asking a question. So, if so, why lab-related issues are ignored? If someone wants to say something, feel okay. Okay. Another issue we also have to address is the increase of the number of laboratory tests in recent years. Studies show that this does not necessarily improve the diagnosis and the treatment. However, it creates a lot of work in the lab. Various studies have found that there are various factors such as the physician years of experience, his specialty, and even the physician gender influence the amount of tests he or she order. The distance from the laboratory also influences the decision to send or not to send a test. As I have already said, it creates an economic burden, higher workload, and increase the chance of unnecessary testing and a false positive result. Here are some examples of studies that have addressed this issue. In this study, physicians were presented with a simulated medical situation, and the results were following. Female doctor order more tests than male doctor. I wonder why. Any idea? Okay, a physician with a longer practice order more tests than a young doctor, young physician. This one surprised me. And a physician who were involved in a case of misdiagnosis have ordered more tests. This makes sense. However, I think this physician needs attention to stop this phenomenon as soon as possible. Here is an additional study. In this study, the cost of the test was revealed to the physician. As a result, the amount of test was decreased. The more expensive test was the first test were ordered. And another study here, the physician was required to justify the need for the test and obtain approval to order it. And here too, a significant decrease was observed. So what we can do? Identify unnecessary duplicate tests and find a way to cancel them administratively. Identify a physician who order tests at a higher rate than other, and arrange a dedicated education program for them. Identify expensive tests and think of way to reduce their amount. Educate medical students and interns regarding laboratory tests. Unfortunately, currently this is not being done. And I think that dedicate a course on the subject of medical laboratory should be added to a medical school program. It must be part of the program because the students don't know nothing about the lab. Another solution, follow-up test. Follow-up test may be added automatically by the testing device. Also is known as the reflex testing, or manually by the lab worker or manager. The use of this method in many cases reduce the time need to reach the diagnosis, optimize the use of a laboratory test, and prevent unnecessary ordering of tests. And here is an example of a testing method that on the one hand allows avoiding many other tests, but on the another hand may also increase the cost of the test. This is a device called the BioFile. It is a PCR detection of multiple pathogen in the sample, eliminating the need to perform a separate test for each pathogen as was done in the past. This slide presents an example of list of pathogens that test by the device in case of suspect neurological infection and gastrointestinal infections. So let's back to Israel. Like everywhere, not everything is perfect. There are gaps in the medical laboratories field in Israel too, I'm sorry to say. In 2015, the state Comptroller published a report that referred to the medical laboratory and list of a number of deficiencies, some of which have already been fixed. But let's see example of a problem that we have in Israel. For example, the Ministry of Health has not found a maximum period for the reporting of the test result, and each hospital or laboratory has set is one local regulation. Another problem, clinical microbiology labs work until 4 p.m. or 11 p.m. and do not work in the night. Meaning samples are not received and the test results are not sent during this hour because we have a lot of problem with resistant bacteria And the result is very important for the patient to get the antibiotic treatment. Another problem, there is a severe shortage of laboratory workers. No manpower standard is defined based on the amount of tests. And also in the state of Israel, the population of laboratory workers is aging population. Over 50% of them are over the age 55. And there is still no plan to recruit young manpower. Another problem, different laboratories provide the lab tests in different measurement units and different form. There is no government plan for emergency preparedness. By the way, this issue is significantly improved following the coronavirus epidemic. Another problem, there are considerable gaps in the rate of rejection of samples between hospital and HMO, and there is still no national program to address this problem. This image demonstrates the policy in our hospital. Every doctor and every nurse who start working meet with the laboratory manager. They receive explanation about the laboratory, instruction for a collection of tests, and critical guidelines for test ordering. Any information that may be relevant is provided. In addition, each staff member receives a booklet of the laboratory test guide, which includes information regarding most common tests. This adds a lot of workload on the laboratory and for me, but is extremely important. Now we are planning a launch on educational software on this subject. So, summary. Laboratory testing play an important role in the patient's diagnostic and treatment process. The relationship between the clinician and the laboratory must be solved on and based on the familiarity with laboratory work process and the needs of the clinicians. There is a need to develop local programs and the national plan to improve the existing situation and strengthen the relationship between laboratories and the medical teams. To finish the presentation, I choose to put this cartoon, and I hope that things will actually come true. So this is all. I would like to thank the whole group that organization this seminar, and of course to Dganit. Thank you for listening. And this is a picture of my oldest son, who is 70 years old, and already engaged him to, I already engaged him to work in a medical lab. And I think it's very important. I'm proud to be a medical laboratory scientist. So now